Okay. Hello, everyone. So I am Kaitlyn O'Connor. I'm a partner at Nixon Gwilt Law, which is a healthcare innovation law firm. I am here because I work with a lot of early stage companies in the XR space that are trying to figure out how to increase adoption and reach actual scale within the healthcare industry. A couple of people today have alluded to some of the reimbursement challenges that a lot of us probably know exist, which really is that there is a lack of reimbursement available at this point. But I'm here to tell you about all of the ways that actually are available that actually might work for you and the customers that you're trying to sell to, depending on who you are. So really quickly, I know a couple people have done this, but the population in the room keeps changing. Who in the room is a developer or building an XR solution for the healthcare industry? Okay, perfect, most of us. Are there any healthcare providers in the room? Okay, awesome. And for the healthcare providers, are you actually using XR right now in your practice? Okay, awesome. Okay, so hopefully the information I'm about to go through is gonna be useful for all of you. My primary takeaway that I hope you all get from this presentation is that there actually are options out there, and even though we're gonna have to work together to educate the industry, the options do exist, and we will get there. So let me make sure I know how to change the slide. There we go, okay. Really quick important notice, I'm a lawyer, but I am not your lawyer. This presentation is informational, not legal advice. Okay, why does reimbursement matter? So like I said, I work with a lot of early stage companies in the digital health industry or in the healthcare industry broadly. And I have a lot of clients coming to me today asking, how do I get healthcare providers to actually invest in my technology? We have the data that shows the clinical benefit, the clinical value of the technology. We can show that patients are more engaged in their therapy when they use our platform. We can show that we reduce pain. We can show that we reduce substance use disorder. But providers keep telling us they can't afford it. How do we get them to invest in the technology? And I think there are a lot of ways that you can go about that conversation, but first and foremost, reimbursement, I think, is a really important piece of that conversation. Because yes, your technology costs money for the healthcare provider, but if you can talk about reimbursement in the various ways, or one of the various ways I'm about to talk to you about, you can help them understand the ROI. So it's actually an investment that will make them more money and make patients healthier. So a couple of the reasons, besides just getting your customers to invest in your technology, that I think reimbursement is really important. The first is patient adoption. So one of the cool things that I have learned about XR generally, especially with my early stage clients, is a lot of the founders of XR companies are academics or really passionate about the benefit that you can deliver to patients. I don't have a lot of XR clients. I actually have had 0 XR clients come to me and say, hey, I really want to make a lot of money in healthcare. Can you tell me how to do that? Everyone comes to me and says, look how cool this is. Look how good it is for patients. What do I do? And how do we get how do we get adoption to happen? And I think reimbursement is one of those ways, because in the US, we don't have a centralized payer. We have lots of different commercial payers. We have federal payers. We have state payers. We have a lot of different people paying for healthcare. And if you don't have healthcare insurance that covers technology or that covers a particular treatment, it's hard to afford it. And insurance is one of the ways that we get patients to afford technology, and ultimately one of the ways that we get patients to have access to technology. I think revenue potential, we kind of already talked about that a little bit. How do you convince your customers to invest in your technology? Whether you're direct to consumer and you're convincing patients, or whether you are B2B and you're convincing providers, revenue potential for you as a company is gonna depend on whether you can speak to this reimbursement question and also which pathway you're gonna take. What is your business model? How are you gonna charge your customers? What type of company do you need to set up? What does your corporate structure look like? And how do you turn that into an actual business model, an actual go-to-market opportunity? Investment potential, if you are working with savvy investors that have invested in the healthcare industry before, they may ask you how your product is going to be reimbursed. And if it's not, what's your plan for ensuring there is reimbursement available in the future? My clients come to me all the time saying, investors ask us this question, can we share this memo that you wrote for me with them so they can understand what our potential is in this space? And then lastly, product development. We've talked a little bit about about privacy and security today and how important that is in product development. I actually also think reimbursement is very important at the development stage, because if you are building with a reimbursement pathway in mind, you need to build with that in mind now, so that when you go to market, your providers can use your technology in a way that lets them leverage these codes that we're about to talk about, or that lets them leverage these reimbursement pathways. Every reimbursement pathway is going to have specific requirements that providers have to follow in order to get reimbursed by insurance payers. And if your product isn't built in a way that makes it easy for them to do that, whether it's through EHR integration or even just really easy to use provider dashboards, you may have some challenges when you actually try to get to market. So there are lots of other reasons reimbursement is important, but it's not the most exciting topic always. So I like to start with why it is exciting, and these are all the ways that I think it's exciting. All right, so let's talk about virtual reality fee-for-service codes. The CPT codes that you see on the screen, most of them are codes that have actually already been mentioned today, which is super exciting for me, because that means we're starting to raise awareness. People are starting to get familiar with what CPT codes are and how they work. So if you were here during the panel about the Elderverse, you probably heard a little bit of discussion about what a CPT code is. Essentially, a CPT code is how providers communicate to insurance payers what services they are providing to patients, how they tell payers what to pay them for. The codes on the screen are virtual reality specific CPT codes. There are probably 10-ish codes in this code set that have that little T at the end. That unfortunately means that they are Category 3 CPT codes. In other words, insurance payers right now have not established a value for those codes, and you're not guaranteed to get reimbursed for them. But the reason that I start with these codes, and the reason that I still think they're important, is because this is how you tell payers where and when XR is being used. This is how payers collect data to better understand the importance of XR, the impact of XR, and what they should be paying for in the future. So even though if providers use these codes, even though they're not guaranteed to get paid more than they would for a traditional service or differently than they would for a traditional service, they're still really important to report to the payer, because it tells the payer that this technology is important and this technology is being used. The other thing is, sometimes payers do pay for them. There's not a lot of good centralized data to understand if or what payers are paying for these codes, but I've heard some anecdotal evidence that some payers will add $20 to the reimbursement for a particular visit if you see 0770T attached to a claim. So I won't spend too much more time on these because, again, they're not paid, and we want to talk about the codes that are actually paid. But the highlighted yellow codes are virtual reality specific codes, or actually they're immersive technology specific codes that may be helpful to you or to the providers in the room or to your customers if that's who you're selling to. The blue highlighted code is really interesting. This is a HCPCS code. It is not a CPT code. That means it was created by CMS, not the American Medical Association. The reason that's important is because that means Medicare is the only payer that is guaranteed to cover this code. Doesn't mean they're the only payer that will cover it. Others may, but it's the only payer that is guaranteed to cover this code. The other reason this code is important is because if you notice, it is, there's that little acronym at the end, DMEPOS, DMEPOS, or DME, which a couple others mentioned earlier as well. That essentially means that that code will only pay for hardware that has software operating on it. So that is not a code for software only. That is a code that Applied VR, if you're in the room, hope I get this right, that is a code that Applied VR went first through FDA clearance for and said this software can't operate without hardware, so we're actually going to ask CMS to pay for both the headset plus the software on it, not just the software. That's really important because a lot of you in the room who are developing new software probably don't want to manufacture headsets, and a lot of headset manufacturers don't really want to or have the resources to develop software. So that's going to be a pain point for you if you're looking at this particular code, and we'll talk in a minute about some of the challenges that will pose for reimbursement generally. All right, so those are, unfortunately, all of the codes that exist in the world that specifically mention immersive technology. So what I want to talk about next are categories of codes, services that are delivered that are not specific to immersive technology, but that likely will present an opportunity for the providers in the room to get paid, or the developers in the room to help their providers get paid when using their technology. So telehealth, this is a really broad term. I assume a lot of us in the room know what telehealth is. The reason I like to bring it up during these conversations is because telehealth is super broad, and that means there are hundreds of CPT codes that are reimbursed as telehealth. In the commercial space, almost every service that providers provide in person, with the exception of like literal surgery, almost every service is also reimbursable as telehealth. So if there's something providers are doing in person that they can do via telehealth, it's probably going to be paid for. It's not going to be a therapy visit conducted via VR specifically, but it's a therapy visit. And if it's conducted via VR or during a Zoom call while the patient is in a headset and the provider's at the office, the patient's in a headset at home, the provider's at the office, likely that visit is still going to be paid for in some capacity. So there are hundreds of CPT codes. Telehealth is generally a service that replaces in-person care. It is not an additional service. It is, again, something that replaces in-person care. One of the challenges for telehealth in particular is, in most cases, most payors define telehealth as a live, synchronous, audio-visual visit, which means video chat like Zoom or FaceTime. During COVID, people could use FaceTime. A lot of EHRs have technology for telehealth built in. What is an unanswered question is whether or not an immersive environment, whether it's AR or VR, whether or not an immersive environment is actually live, synchronous, audio-visual communication. I think there's a strong argument that it is, but payors have not yet answered that question for us. So what I usually say is, if you are looking at telehealth as a potential use case, I would focus more on opportunities where there is a live video visit happening and the provider is observing the patient use their headset at home rather than conducting an actual visit in that immersive environment. It doesn't mean that visit in the immersive environment won't be paid for, but it's not what the telehealth codes were initially created for to cover. So I still think telehealth is a really big opportunity. Again, there are hundreds of CPT codes, hundreds of services that are paid for via telehealth. And if there's any way that your technology can be used in an in-person environment, there's probably a way for it to be used in telehealth as well. Remote therapeutic monitoring. This is actually my most exciting piece of information because I think this is the most applicable to most XR solutions that I have seen. So remote therapeutic monitoring, or RTM, is a set of codes that reimburses providers for teaching patients how to use technology, whether it's a device or a platform, supplying that device to the patient, so that can be software, it does not have to be hardware. When we said earlier that the applied VR code includes hardware and software, this set of codes does not require a headset. So if you are the software developer only and your patients already have a headset, or if you're the software developer only and your healthcare provider customers already have a headset, they can still get reimbursed for this and they can still pay you in addition to whatever else they're doing. And then it also reimburses for time spent monitoring data and managing the care plan. So, for example, remote therapeutic monitoring is usually super applicable in a physical therapy use case, a lot of times respiratory, which isn't as XR focused, but if you can think about in a physical therapy use case, you have a platform where your patients can do their exercises multiple times a week at home. That is probably a good place for remote therapeutic monitoring. Anytime the patient is doing something on an ongoing basis and your platform is transmitting data to the provider that the provider can review and make decisions about the patient's treatment plan in between visits, that's probably remote therapeutic monitoring or some form of RTM. So again, it's reimbursement for teaching the patient how to use the device, supply of the device to the patient, and then time spent monitoring the data that is collected from the platform that the provider reviews. One other thing about RTM that is really cool that I think aligns very well with XR is that with the exception of that first code teaching the patient how to use the platform, the supply of device code and the time spent codes are both monthly recurring codes, which align very well with a SaaS model. So if you want to charge a subscription to your customers, X amount per patient per month, they're actually going to get reimbursed per patient per month for those services. So one, it gives you a really clear way to determine ROI. It also gives you a really clear way to develop your cost structure and what you can and can't charge to your customers. And again, allows you to charge that ongoing SaaS fee with a really clear picture of what the provider is going to get out of it. So that's RTM. RTM is commonly used in, like we said, respiratory monitoring, musculoskeletal system status, for example, PT or OT, other types of therapy adherence, medication adherence, so for the substance use disorder treatment platforms in here, medication adherence can be really helpful because you can get a good picture of how patients are using their medication and how they're not using it. And then CBT as well. That's a good one for the behavioral health, mental health platforms in here. If you are administering any type of behavioral health, the code says CBT. There's a typo in the rule that makes it broader than cognitive behavioral therapy as we all know it. It actually says cognitive behavior therapy, which is not a clinical term, so I think we can define that broadly and apply it in a lot of mental health use cases. But talk to me before you do that because we should have some good documentation. But there are broad use cases for that. Mental health and physical therapy in particular are where I see XR most applicable, at least with my clients, and so RTM aligns really well with those use cases. Moving on, remote physiologic monitoring, or RPM. This is very similar to RTM, but this is for monitoring physiologic data rather than therapeutic data. So for the platforms that run on headsets that have already integrated certain sensors, or for the platforms that have already figured out a way to measure, for example, EEG while a patient is using your platform, heart rate, blood pressure, if you can do that, pulse oximetry, any sort of physiologic metric that your platform can incorporate into whatever data you're showing to the provider or whatever results you're giving, that would be a physiologic metric that can likely be monitored under RPM. So if your platform integrates maybe your software that runs on a headset plus the patient's blood pressure data from a connected blood pressure cuff that they have, or the patient's weight that they are measuring with a connected weight scale every day. That is likely RPM, and there's likely a way for you to tie that reimbursement to your platform. The good thing here is that just like RTM, this is a recurring monthly reimbursement. So if you charge your providers per patient per month, your providers can turn around and get reimbursed per patient per month. This is a set of codes that, as far as I know, almost every commercial payer is paying for, as is Medicare. So broad adoption of the RPM codes and broad coverage of those RPM codes. And I'm going through this very quickly, but I will give you a couple of links at the end of this that will give you some more information on all of this. Okay, digital therapeutics. We've talked a lot about digital therapeutics today, and I actually think that in the future, when the laws and regulations and reimbursement structures catch up to technology, digital therapeutics is probably where we're all going to be living. Because right now, there is actually no federally defined digital therapeutics category. Medicare does not right now pay for software-only solutions. You might be like, well, you just said RTM can be for software only. The difference is the existing RTM code set is paying for the provider to supply the device to patients. So they're paying the provider for a service. There is no mechanism for CMS to pay for a software platform. There's no mechanism for you to go to CMS and say, this is my software, this is a product that we want you to pay for, because there's no hardware attached to it. So Digital therapeutics is probably where we will all be living in the next year or two, but first we need Congress to create a reimbursement category for digital therapeutics. In other words, we need Congress to give CMS permission to pay for software only as a product, as an actual device that gets supplied to patients, or as a form of treatment. That's Medicare. It usually requires FDA clearance, usually is used independently or in combination with other therapies. Again, a lot of what we've heard today sort of mirrors both of those use cases. But there are scarce opportunities for reimbursement, at least in the public sector. There are commercial payers that are paying for digital therapeutics, but usually that requires a direct contract with the payer, which is just a little bit more challenging because you have to go contract directly with the payer, which is a very long sales cycle, and you don't always have a lot of leverage in those negotiations because there's no CPT code that's been valued that you can go to the payer to explain how much your product is worth. So the takeaway for digital therapeutics is this is probably a future opportunity if you are a software platform that you think will be used independently or in combination with other therapies, and you're going through FDA clearance in particular. This is probably what you should be thinking about. And if you want to talk more about digital therapeutics, I'm happy to talk to you after this. My colleague, Carrie Nixon, is doing a lot of work on the policy front to make sure that Congress does, in fact, introduce this new category of reimbursement. So that's digital therapeutics. That's a big topic. You'll probably hear a lot of people talking about it this week, but just keep in mind that it's sort of that future reimbursement opportunity. And then a couple of other opportunities that aren't specific to the CPT codes that we just talked about. So just because, if I just went through all of those CPT codes and you're thinking, wow, none of those apply to my software, why am I even here? There are other opportunities. So for example, MindVR has been on the stage a couple of times. They've partnered with a lot of different payers to deliver their solution directly to payers. If you heard the Elderverse panel, I think it was, or maybe it was, actually I think it was the CEO earlier, talking about how MindVR was, or Mind Immersive was the first company to become a supplemental benefit under a Medicare Advantage plan. That means they work directly with the Medicare Advantage plans, the commercial payers themselves, to be added to their coverage. They didn't say, there's a CPT code for this, providers can go bill it. They went to the Medicare Advantage plan and said, pay for us as a supplemental benefit because it's really valuable for patients. And they were successful in that, and that's really helped them grow within the healthcare space. You can be a provider. XR Health, for example, on their website, if you're in the room, let me know if I'm not getting this right, but from their website, XR Health is an in-network provider with most insurance companies. So you can contract on a professional contract level with payers for them to pay directly for your solution, for your software, for your services that go with the software. Again, that is challenging just because you have to go payer by payer, sometimes region by region, state by state. It's not a perfectly scalable path to market, but it is a really good way to demonstrate initial traction. So if you're still figuring out an initial go-to-market pathway, I actually still think that contracting directly with payers is a good opportunity. I've had several clients actually have a lot of success there. And then lastly, value-based payment. This is also very exciting, but probably more of a future opportunity. There has been a lot of discussion in healthcare about shifting from a fee-for-service reimbursement model, which essentially is all of those CPT codes I talked about, shifting from that to a value-based model, which is no longer relying on CPT codes and instead paying for, insurance payers paying for outcomes, reduced costs, healthier patients, less emergency room visits, et cetera. I think that if you can prove that your platform delivers those kinds of outcomes, the gentleman from HTC was talking earlier about how HTC is working on calculating cost savings when implementing their technology or when implementing XR versus emergency room readmissions, et cetera, within a hospital. If you can demonstrate that, I think you'll have a lot of success in that value-based environment when we get there. We're not fully there yet, but again, commercial payers are doing a lot more on the value-based side, just like they are with digital therapeutics. So not opportunity, but just something to think about. There's going to be a lot of evolution in that space and a lot of growth there as well. Okay, I have 0 seconds left, which probably means I don't have time to take questions, but I will be around if you have any questions. Oh, also, We'll skip that one. If you want more information, the left QR code will take you to an article that's on our firm's website that talks a little bit about this and links to a lot more detail on all of the things I just talked about. And then the QR code on the right, if you want to send me an email and you want to follow up or anything like that, please feel free to scan that. Should just open your mail app and all you have to do is press send. Okay, that's all. Thank you.